Insulin treatment is necessary in all patients with type 1 diabetes. Now, type 1 diabetes is the young individual who develops diabetes within the first few years of life or during adolescence. And these individuals, they lose their pancreas completely. There's no secretion of insulin after a while. And therefore, they're going to be taking insulin injections for the rest of their lives. There is no other treatment today that would replace the insulin as well as daily insulin injections. Patients with type 2 diabetes do have a defect in insulin, have a problem with insulin secretion, but that's late after they have been diagnosed. They usually start the disease in the adult life. They are overweight, obese, and the vast majority will eventually require insulin injections. But they can be treated with oral agents, with pills for a while, and some of them will never go into insulin. Today, for example, we have about 50% of the patients with type 2 diabetes on insulin. The other 50% are not on insulin. So insulin is required because over time the disease progresses, the pancreas deteriorates, the function of the pancreas goes away, and the insulin secretion kind of vanishes over time. So you will need insulin because there is such a resistance, a difficult for the insulin to act at the muscle and the adipose tissue or in the fat and in the liver. So with that difficulty means that you will have more and more need for insulin, and your pancreas cannot produce enough, so you will need it. So it's a slightly different situation from type 1 diabetes where you need it absolutely, you have nothing. You have no insulin whatsoever. Type 2s do have, adult patients with diabetes do have some insulin in the circulation, but eventually that will be insufficient. So they will need additional insulin from injection or other sources to treat their overall energy metabolism, so to speak.